Hello, everybody. We adjusted everybody else's mics except for mine. Hi, everybody. I'm Jennifer Keller, and I'm excited to welcome you to this evening's celebration of Westport authors. The Westport Library created Saugatuck Scribes series to highlight the works of the many writers in this town, and we always have fun at these events. This evening, 2 of our neighbors will be in conversation with 2 others from our community to share their stories. We're going to do this in sets of 2. So first up, Tracy Livecchi is a clinical social worker who was born with a complicated congenital heart disease, which necessitated several surgeries throughout her life and provided us with her book, Healing Hearts and Minds. Her experiences and her therapeutic career give her an insight to coping and growing with chronic illness that will help many others dealing with these issues. She will be in conversation with Cheryl Kane, who is herself also a writer and a teacher. Then we'll have Margrit Strohmaier's experience with her daughter begging for a pet that caused her first book, What to Know Before You Get Your Dog. And now she's here with What to Know Before You Get Your Cat. Pets need a lot of attention, and her books remind kids and their parents of all those responsibilities. Margrit will be discussing her writing and the joys of animals with Julie Laparo, who rescues dogs herself. So first up, Tracy and Cheryl, if you would come to the stage and give us a little insight.
Thank you, thank you. We need all the applause that we can get, and we enjoy it. And we are here to enjoy such a creative heads and minds. It's just amazing to me that here we have 2 authors, you and your co-author, who so brilliantly created a book that we all need. Are you ready for this? 80%. Yes, I just said 80% of all women in the United States are impacted by a heart-related disease at some point in their lives. That blew me away. And what was really funnier is that I was asked to speak with you, and I don't have a heart lining. Because at 9 years old, mine was infected. They took it out, and they had cases of people in their 90s, women in their 90s, who had that, and then me at 9 years old. And I'm still here. So you never know. But what I love about you and your history is the way you took one disease and have made it your mission, your life, your career, and what you do for us and others.
Well, thank you so much for that. It is true. This is my life's work, in addition to raising my 2 daughters, of course. And throughout my life, I have been in and out of the hospital, as everyone has heard. And the thing was, I noticed such a gap in services and awareness about the importance of the emotional piece that was really missing. So I decided I needed to do something about it. And I started writing probably about 15 years ago and have a few articles out and have a private practice here in Westport. And I've been here since 2009. And I see a lot of cardiac patients and folks with chronic illness in my practice.
Well, what I really like is your connection. And this is rare to me, so you can tell me if I'm wrong. I have never seen the connection like you have with mental health and the need for it, mental health for help.
Yeah, I noticed it in my life that people weren't asking me, how are you doing emotionally? At 13 years old, I was in the hospital 3 times in 1 year, and nobody even asked that question. And even back then, I didn't have the words for it, but I knew this isn't right. There's something missing. So, when I see cardiac patients in my practice, they basically tell me the same thing. that they also are feeling the effects, the after effects, and really didn't get any kind of support. And the thing is, it's not their doctor's fault. Cardiologists are survival focused. They want us to survive, so they're not really thinking beyond that. They're not trained beyond that. But somebody needs to be. So that was one of the reasons that we wrote this book.
Well, are you aware that congenital heart disease is the most commonly diagnosed birth abnormality here in the United States? Can you tell that all my research blew me away?
That is true, Cheryl. It is the most common birth defect actually in the world. And here in this country, there are 2.4 million individuals living with a CHD, and globally, there are 12 million. And one thing that people don't understand is that it's incurable. This is a lifelong illness. And so there are amazingly statistics that say a lot of people drop out of care when they become adults. In fact, about 80 to 90% of folks with CHD think that they're cured, and they go on and they don't really follow up, or they're seeing a regular cardiologist who isn't trained in congenital cardiology. So that's another message that I wanted to get out, is that if you have a CHD, you need to find an accredited center with a specialist to treat you.
Well, what do you need to look for? What do you need to know? What are the symptoms? When should you go see a doctor or find the right connection for you?
Well, most individuals with a CHD are diagnosed in utero through ultrasound, fetal echo cardiograms, or at birth. I was diagnosed at birth. Most people are, although there are some adults that find out later in life, sometimes during pregnancy. They start having symptoms, shortness of breath or other cardiac-related symptoms, and that's when they're diagnosed. Another thing that I really advocate for is for everyone to have at least one echocardiogram, because a lot of these defects and anatomical defects go unnoticed, and sometimes they go unnoticed until it's too late. So I think just as we all get mammograms or colonoscopies, we should all go out and get an echocardiogram.
You're also a member of an organization, a support organization for people with this. And how do they know? Do they always know from birth?
Most of them know from birth. I am part of an organization. I'm the mental health consultant at the Adult Congenital Heart Association, and I started for them a peer support program, which now has 40-something adults around the country. And so if somebody comes to us and says, oh gosh, I need to get a pacemaker, or I need to have open heart surgery, we'll connect them with another individual who had already been through that, because peer support is shown to be super effective.
And what do you think is the most important factor that people know about if they've heard of this as a history in their family, or if they just know that they want to take special care of their heart because they're unsure what might be coming?
Well, I think they need to get checked, right? They need to have that echocardiogram. A stress test, an EKG will not show if there's an anatomical defect. The other thing that a lot of people get confused about is the difference between congenital heart disease and coronary artery disease. They're not the same thing. So with congenital heart disease, that's a structural, anatomical defect in the way the heart is formed. And with coronary artery disease, that's something that develops over time. It's progressive, and it's usually connected to age, lifestyle, cholesterol. So the two are very, very different. And if you have a congenital heart defect, you need to be with a specialist in an accredited center. We're all really lucky because we have a lot of accredited centers here. We have one at Yale, we have one at Hartford Children's, NYU, Columbia, Mount Sinai. But some parts of the countries don't have anything, and they have to travel long distances to find the help.
Well, I know you have 2 children, right? You have girls? I have 2 girls as well. Were you worried in any way? Does this pass through families? Like, did your parents have this? Or is there a tracing that you know that, oh, I might have to deal with it?
Yeah, that's a good question. I was very worried because I had been getting conflicted opinions about being able to safely deliver children. And so I had to go through a lot of tests. I got a couple of different opinions. What I have is not genetic, but some of these other types of defects are. And there are over 35 different types of congenital heart defects, and some are genetic, some are not. They don't know what caused mine, but it is one of the more complicated ones.
Well, they say that there's a 75% improvement on people identifying this CHD. What do you think of that? What would your goal be? And can it really happen, since some people are just born with it like you were?
Yeah, I think I mean, compared to the mid-20th century, we are diagnosing this very early, which is great. Again, there are ultrasounds, fetal echocardiograms. The survival rate since the mid 1900s has
1940s actually.
1940s has skyrocketed by 75%.
Yeah.
Or more.
Right. So what should we do to avoid issues like that? Is there anything we can do?
You know, I'm not sure. I'm not sure that it can be avoided, but I think what's important is to identify it early, and to know if you have any kind of serious chronic illness, that there's a lot that go with it. So there are a lot of, you know, in my book, the first part of the book, we tell our stories, and then after that, there's some history of the technological advances that have occurred, and then we present a lot of the challenges and issues that are related to having a congenital heart defect. That's the first half of the book. The second half gets into what to do about it. So we have chapters full of evidence-based strategies on how to handle a low mood, trauma-related anxiety, preparing for surgery, recovering for surgery. We have a lot of strategies in there. We also have a chapter on dealing with important people in their lives, like parents, separating from parents, dating, what to tell a date. My date's sitting right here in the front row, and I remember being really nervous about telling him that I had a pacemaker when I was 25 years old. So we tackle all of that in the book, and some of the feedback I've gotten is that this is really appropriate for really any human being, right? Because we all have different emotional feelings, and so some of these strategies can be applied to everyone.
Well, I want everyone to know that both writers of this book both have CDH. So how did you meet? How did you find someone else that was just as devoted to changing things as you are?
Well, that's the fun part. I was giving a lecture on body image, and I came across some really cool slides of people with congenital heart disease and their scars, because you don't see our scars. This is a hidden illness, right? You would never know looking at me unless we were at the beach. So she had these awesome big posters, and she was in Scotland, and I emailed her. I said, could I use some of your slides for my talk? And we became friends. And we started talking about our advocacy work and our writing. And I think I dropped on her one day, I'm writing a book, and she said, I am too. And we exchanged outlines, and they were almost identical.
Wow.
So we partnered up. We still have never met in person, but we have virtual coffee, and she's actually coming to visit me next month.
Wow.
Yeah,
Should
her
we
whole
all
family.
join them when she comes to visit? That's fantastic. See, I'm learning things that I didn't know either, and I had to grab her right away to sign my book. I didn't know. She thought she was going to get away with it. So if there's one thing you want us all to remember, that what you have to tell us because of your experience, can you share that with us so we'll remember and know if that's our experience, we need to go to a professional. What do you think?
Well, since my book is about the mental health aspect, I would say that if you are dealing with any kind of a chronic illness and are feeling a certain way, low mood, maybe some grief, maybe some feelings of loss, a lot of that is very normal. It doesn't necessarily mean that you have a disorder or a diagnosis. It might just mean that you need extra support. In my book, I also outline how to know when it's a normal experience to a very unique life experience versus needing more professional support.
Wow. And I hope you're all thinking about what you want to know, because she's going to come back soon and answer your questions. And I want you to know exactly what you need to know, because there's so much. The book is so easy to follow. It's really a marvelous, marvelous book. So thank you very much.
Thank you, Cheryl.
Thank you.
Thank you all.
Okay, Margrit and Julie are going to come up. And yes, questions will be answered after both presentations.
Ready? All right, that's a tough act to follow. How smooth are they?
It sure is.
So, permit me to gush a bit, Margrit. I, involved in animal rescue here in Westport and throughout Connecticut, and your books are just wonderful and so needed right now, especially. So I thank you for writing them.
Thank you.
And in writing that, reading your books, I jotted down some questions. I know it's a little different format, but once I start talking about dogs and cats, I get a little off track. So I jotted down a few questions, and I hope you don't mind if I run them past you and see what the process was in writing your books.
Perfect.
That I adore.
Thank you.
Okay. So you include a very sweet dedication in your book, What to Know Before You Get Your Cat, to your parents in regard to their adoption of every cat that showed up on their doorstep. Did you reference the knowledge that they passed down to you appropriately and lovingly caring for cats in the writing of your book?
Yes, my parents were a huge influence in the approach how I deal with caring for cats. And I grew up in Austria, and it was very common back then that families kept their dogs and cats outside. So my parents were one of the first ones who brought their pets to the vet. Our cats and our dog was living inside with us. They gave them a healthy and safe environment to live in, which was back then very important to me. And that was a long time ago, maybe changed now, but when I was little. So yeah, I did learn a lot from my parents about proper cat care and pet care. But I think the most important thing for me was really the way that the pets were treated like family members, and they have the loving care they should have. And that's what I think was the most important thing. So I would say I drew on both. I drew on the practical knowledge my parents had taught me, and also on the physical aspect of treating cats or dogs as part of a family.
Oh, that's lovely. We had similar parents, I think.
Yeah, I had great parents.
You mentioned that your daughter's desire to have a dog join your family was the inspiration to write your books. I'm wondering, as this is what I found, there aren't a lot of clearly written books for young children that outline all the important points you mention and cover so well in your book. Did you find that to be true as well?
Yes, that's absolutely right. When I was looking for books to help my daughter learn about dog care, there are so many books that were just way too complicated for little kids to even understand. And then there were so many, they were so simplistic that the most important topics were not even covered. Yes, that's absolutely right. I also found books where dogs were outside still living in dog houses, which is not
Makes me shudder.
something which aligns with, the treatment of having a dog being part of a family. So yes, I absolutely found that as well.
Okay. The timing of the publishing of your books was very beneficial in regard to pandemic pets. Everyone was getting pets for their kids, sometimes without giving appropriate thought into what is involved with the care of a cat or a dog. Was it your hope, in addition to educating children, you would educate parents in the process by involving both in the cat-dog care contract provided at the end of the book?
Yes, it was definitely my hope and a big goal to educate children and the parents, because it is important that everyone in the family is part of, before they adopt any pet, the whole family should be in agreement. So the dog care or the cat care contract and chart was something I put in so they can start a conversation before they are bringing a pet home to their family. It will give them an opportunity to talk beforehand, who does what chore, will they be committed to do that every day? Because you know how sometimes kids are, they promise they do it, and then a week later, they have something else to do. But yes, it was definitely something I wanted, that both parents and children be educated and learn about proper dog care.
And do you have the contracts at your?
Yeah, I have it here, so
They're so great.
I love
that. You know, I loved seeing that contract at the end of the book. That's so great. I mentioned pandemic pets purchased during the pandemic and subsequently abandoned. Knowing the high level and specialized care that needs to be provided for any pet that's brought into a family, there is certainly a need for other what to know before you get books. Will you be writing more, please?
Yeah, it's extremely sad that so many people actually bought pets during the pandemic and then they were just left stranded or being brought back to shelters. There was a big determination why I wanted to get my first book out, and that literally came out during COVID. Yes, there will be more books in my What to Know series.
I know. I mean, as I think I mentioned, there was a week where our rescue group got a knock on the door. We had rabbits, we had a tortoise, we had, in addition to cats and dogs, and I was like, there's just so much level of care. So for each pet. So I'm glad that you're considering doing more. And then my last question is, my daughter is an elementary school teacher, and I often go into the classroom and talk about the proper care of pets, and I'm sometimes really surprised how little sometimes children know about the appropriate care. So do you see yourself as participating in educational programs like in a larger scale, nationally, like, I'm not sure exactly how, but I think it's really important that somehow children have a way to learn about caring for pets.
Yes, I definitely see myself doing this. As a matter of fact, I am part of an amazing program which is called Muddy Grease. It's a collaboration between North Shore Animal League of America and Yale University. And I am reading and talking to the children throughout web seminars. They have over 5,000 schools and libraries throughout the United States and Canada. So I love that. I love that program. So that is, and also actually Monday, Tuesday, this coming week is Pets Week in Fairfield at the Presbyterian Nursery School. So I'm going up there and I talk with the little ones on Monday and Tuesday. And they are 2s, 3s, 4s, and 5s. And
never too early.
But it's never too early, exactly. So yeah, I'm looking forward to that. Yeah, always, that is a big passion of mine, to educate people, to educate children, and to get the word out.
Okay. And I was thinking about this because it's coming up. Are you going to be participating in the Westport Dog Festival at all? Will you be there?
I usually am. I always go there, yes.
Okay. Then I'll see you there. So I think that's it. I just want to thank you again for these lovely books, and I am going to stock my shelves with them. We adopted out a litter of 11 puppies last summer. Too many families had that small children in, and I was like, oh, I wish I had those books with me, but I will. From going forward, I will have them.
Thank you so much.
So thank you.
Thank you, Julie.
Thank you, Julie. Margaret, you're going to stay here. Tracy, if you would come back to the stage. If anybody has any questions for our fabulous authors, we have a microphone in the back. Right where it says the Westport Library ad nauseum. And you can ask your question there because we are recording this so that they can use the questions. Before we get started with audience questions, I am going to ask you both a question. My question to both of you is, so you're still very new to writing books. What was the thing that you learned, or things that you learned about writing books that you had no idea was even part of writing a book? Or what did you find that you hadn't thought of before you started? Tracy, you can start.
Sure. Well, I found that I'm really good at night. I did most of my writing at night after work. And, you know, I remember when thinking about this book, I was imagining that I would have to you know, publish it myself. I was planning on doing that, and I was really, really surprised when I said, oh, let me just try to see if I can attach a publisher, and we got 2 offers. So I would say to the audience, go for it. Try, you know, do whatever you need to do, and you might surprise yourself.
Margaret?
I found that the writing part was the fun part, and I truly enjoyed that. The hard part for me is the marketing, social media marketing.
Marketing,
that
always the
just
hard
so
part.
hard, and yeah, so.
I completely agree. Great. So it looks like we have an audience question. Sir, if you'd like to come up to the microphone, please.
Yes, thanks. So I know a lot of people get confused about the difference between an echocardiogram, an EKG, a stress test. Like, what's the difference? What do you get? Why are they important? Tracy, could you tell us the difference between them and why an echocardiogram is important?
Sure. I'm certainly not a cardiologist, but I can tell you my layperson's, I guess, definition or just description. An echocardiogram shows a picture of your heart. So it looks at all of the different chambers and valves and makes sure that everything's where it should be. Whereas an EKG that most people get when they go in for their annual physical shows the rhythm of your heart. And a stress test is when you're basically exercising on a treadmill or a bicycle, and they're looking at what's going on while you exercise. But to diagnose a CHD, it really does generally require an echocardiogram.
Hello, of course I have a question. Tracy, I need to know, I want everyone in the room to know what symptom they might experience, and that means that they should go see a professional doctor.
Well, I would say anything that you're worried about, right? Shortness of breath, chest pain. A lot of women tend to ignore that. I remember there's a really cool video about a mom with her kids, and she's getting them ready for school and making smoothies for her husband, and she's ignoring that she's getting, you know, these flutters or this pain in her chest, and she ignored it a little too long. So I would just say, if you're worried about it, go get it checked. Go and visit your doctor, and if your doctor doesn't take you seriously, see another one. And, you know, I always say no one's going to speak up for you unless you do it yourself.
Tracy, I have one more follow-up question for you, which is, specifically around providing emotional support to a kid from your kid, in the sense that if you know a young person who has CHD and maybe vacillating back and forth between wanting to just be like everybody else and maybe being a little fearful and not being able to engage in some activities, like what's the best way to emotionally support a kid like that from their peer group?
Yeah, that's a really good question, David. Because as a child with a CHD, oftentimes there are limits on what we can do physically. I remember sitting out of PE and feeling a little awkward at recess because I couldn't go do the gymnastics everyone was doing. There's also scarring to contend with. You know, kids aren't always kind. So I remember being very embarrassed by my scars, and a lot of kids do talk about that. And I think as a parent, it's just about really keeping the door open and letting them talk about how they're feeling and helping them to celebrate the other things about them, right? They have artistic abilities or are good writers or a good friend, and also not pulling them back too much. As a parent, I know it's really important to protect our kids at all costs, but I'm actually seeing adults now that were so protected that they're really afraid to live a full life, you know, and I would just say, encourage them and encourage them to take control of their health care. You know, step out of the doctor's office at that certain age and let them ask questions and lead the way.
I see another question at the podium, at the microphone.
Hi, yes, I had a question for Margrit. I'm curious about what unique considerations there are behind writing a book, directed at an audience of children as opposed to adults. What are the kind of unique challenges? What advice would you give to someone who's looking to, write to an audience of children for the first time?
That's actually a very good question. For instance, for my book, I wrote to children between 3 and 8 years old. So I wanted to make sure the book is easy to read. So I wrote it in a rhyming format. I put a lot of illustrations in there. For me, it was that the kids actually, when they go through each page, that they see, they remember it from page to page, even if they can't read yet, but they do remember the pages and they know what's part of taking care of a dog or a cat on a daily basis. Because as we all know, this is not just, having a pet is not just, as something kids or people do for a couple of years or so. It's a lifetime commitment. So I would say anyone who wants to write a children's book, do a lot of research, talk to a lot of children, which I did, go out there, and I brought my daughter to many of those shelters, just having her work with animals and see if she actually would do something like that for the next 10, 15 years, as long as our dog lives. So you have to put yourself into the mind of the little ones. That's what I did for my book, because it's really for very young readers.
This question is for Margrit. I just wonder, is the biggest mistake people make is giving a pet as a gift, and then it's sort of considered almost like a toy, and the whole pet ownership and commitment to raising it as a member of the family, like you were saying, then you run into problems with that?
Yes, that is definitely, I think, the biggest mistake. People, they get into something they do not know what's involved. And like in my case, my daughter was begging us. We had a dog, we had a big dog, but she was begging us. She wanted a little one, I mean, forever, since she was little. And when she was finally 8 years old, I took her out there. It took her 2 years to get her little dog, because I had to educate myself too how to deal with small dogs. I grew up, my first rescue was a German Shepherd, and I always had large dogs, and I wasn't even sure if a small dog can be with a big dog. But that was something which was extremely important to me, that kids are educated beforehand and they know what's involved, because like you just said, I saw personally from, not my friends, but from other families where they gave their kid a dog or a cat for Passover or Christmas or birthday, because the kids were just begging them and they just wanted to give in and just get them a little puppy. And then unfortunately, a few months later, they didn't realize that this is a commitment for life. And those dogs were put back into shelter, so they are rehomed, which is just stressful for everyone, but mostly for the pet who is then rehomed, yeah. It's a big problem. People do like to give pets as gifts still.
Yeah.
This is a question for Tracy. In terms of your two daughters, and how did you work with your daughters as you were sick? And the future was sometimes probably not poorly known, and deal with all that.
Yeah, that's a really good question. It was hard. You know, it's hard as a mom. I was in the hospital a couple of times. My kids are now, I call them adults in training. They're 19 and 23. But, you know, I was always open with them as it was appropriate in terms of their age. I didn't give too much information that was unnecessary, but it's, you know, it's always going to be a part of their lives. And so they've always known about it.
Mm-hmm. And I have a question for Margrit. Having had just one cat in my house, our house, with our kids, but many, many dogs, you know, I prefer dogs. But there are generalities that I think about. That's a difference between dogs and cats, certain similarities and differences. Is that a general statement you can make, or with all the different types of dogs and cats, can you make general statements about them, or there's so many differences you can't make those statements?
Yeah, there are so many differences. Every cat and every dog has a different personality. So it's kind of hard to make a general statement on that, I would say. And my dog sometimes thinks she's a cat, you know, because my friend is right here. She has a cat and they're best friends. And her cat does not like other cats, but she likes our dog. So, you know, she's like, you never know, but they have different personalities. Thanks. Yeah. 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 They bond really well, yeah. Yeah. No, animals are amazing. Amazing how they survive and how they bond. They know how to survive and they know how to give love. It's amazing having a pet. I think everyone should adopt a pet if they are committed to taking on such responsibility, because what you get in return is just priceless. All the love, all the experiences. And for children, it's actually when children start taking care of dogs or cats at a very young age, they learn a lot of skills. They learn how to be responsible. They learn how to be patient, respectful. And so when a little kid can say every day after school, I will walk the dog, that's a big commitment. And if they can do that at a very early age, they're gonna be, you know, definitely successful in life if they can keep a schedule as a very early age. So yeah, I would highly say everyone go out there, adopt a dog and a cat if they can, you know, take on the commitment for forever for life.
Okay, before we let you join your adoring fans, I like to end Saugatuck Scribes with the two authors asking each other a question. So, duke it out. I don't care who asks which question. Tracy, you can ask Margrit. Margrit, you can ask Tracy. Got anything?
I'll go first. So I just coincidentally got a puppy. And it's my first puppy as an adult. So I'm really learning, and I'm going to have to get the other book about the dog. Even though it is a child's book, I'm sure I'll learn a lot. But she nips a lot. What can I do about the nipping? Do you know what to do about that?
She's an adult dog already, and she's still...
She's 5 months.
Oh, yeah, that's a typical puppy phase. Yeah, try to, when she nips, try to give her a toy or something to get her away from the nipping part. And when she gets away, then play with her, embrace her. But yes, I mean, it could...
So it's normal. You're saying it's normal.
Okay. They love to nip, they love to chew. Lots of toys, I would say, around the house, and a lot of attention. It's a normal thing, yeah.
Do you know when it ends?
Sometimes never, no. Just kidding. No, it doesn't.
All right, thank you.
Yeah.
Okay.
No, Tracy, I wonder if you can, what are some kind of self-care practices or coping skills you can give us or recommend for someone who has a chronic medical disease?
Yeah, I mean, it depends on, I guess, how they're feeling or what symptoms they're having, but self-care has to be a priority. I feel like a lot of the people that I work with are always taking care of everyone else, and they have a really, really hard time setting limits and saying no. So I would say learn how to set some limits in a very loving way, and treat yourself as you would treat a loved one. So whatever you would tell your loved one, I want you to start talking to yourself that way and really having more self-compassion. And I think that's something a lot of people are lacking. So that's really the first step to self-care, and to make sure that you incorporate fun in your life. So even if you are having some symptoms, you know, try not to focus on the symptoms and try to focus more on what you can do instead of what you can't do.
All right, that's a good point, yeah.
Great. Thank you so much, both of you. And thank you all for coming out tonight for Saugatuck Scribes. Both Tracy and Margrit have their books right there for you to purchase, and they will sign them for you. So please consider supporting your Westport authors. Thank you so much for coming. Good night.